Missouri is in the bottom half of states when it comes to the health of pregnant women and new mothers. But doctors hope the investment of state dollars will change that. A 2021 study by the Centers for Disease Control found Missouri sees 28 deaths of the mother per 100,000 live births. That's about 6 more than the national maternal mortality rate, but it is lower than it was in 2020. Dr. Jean Goodman says poor health before pregnancy leads to health issues during and after pregnancy, like obesity and drug use. In 2023, Missouri invested $4.4 million into creating a maternal mortality prevention plan. This year, another $7.2 million was invested into the effort. Missouri Hospital Association says you can see that investment in the Missouri Perinatal Quality Collaborative. That's a team effort to improve the health of mothers and children through things like creating grants, identifying gaps in health care, and developing easily available resources.
Education is key. Educating women on needs before, during, and after pregnancy and for care of their babies, and getting that messaging out to our citizens. The other key is access.
The Missouri Hospital Association does say it will take many years of work to see any significant decrease in the deaths and health problems of Missouri's pregnant women.